Well, digestive issues, what does that encompass? Things like diarrhea, constipation, gas, bloating, and abdominal pain. 74% of Americans say they've been there.
Yeah, and 80% have experienced low back pain. Similar figures there. Is it a coincidence? The two conditions may be more related than you'd guess.
And here to add some context, Dr. Drew Drummond. He joins us from the Spinal Balance Health Center. Good to see you, Doctor.
As always,
yes.
great to have you here.
Nice to be here.
You've talked a lot about this. Well, spinal pain, misalignment. How does this all relate to the digestive issues?
When you deal with neuromusculoskeletal problems like we do, we get a lot of low back pain patients, and that's just kind of what we're known for, and we get really great results. But incidentally, there's a side effect of fixing the low back, and that is that digestive problems will resolve on their own, because in the low back area, you have vertebrae that are stacked up on top of one another. And in between those vertebrae, there are what are called foramen, which are holes that the nerves branch out from. So when the low back is imbalanced, it will start interfering with those nerves. And those nerves in the lumbar area are feeding the bowel, the bladder, the digestive system, the reproductive system. So it's very, very common that we'll get people that will come in with low back issues, and then just a side effect, a good side effect of straightening out the spine is that their constipation, their diarrhea, their cramping will just kind of dissolve away.
Yeah, so you're saying it's not a coincidence at all, those figures we put out in the beginning.
I don't think that they're probably directly related, but I think that there's a significant amount of low back patients that are digestive patients at the same time.
When you have those digestive issues, your diet is the first thing you look at.
Yeah.
So to think that it's not related to that at all is kind of mind-blowing.
Yeah, that's what we're told, is that we don't talk about our bowel movements very often in public, but when they're not going right, we're told, oh, you need to eat more of this, or you need to eat less of this.
Right, drink more water, eat more fiber, whatever.
Yeah, and that's just kind of where our brains go. It's like we know, okay, I can't eat eggs because this is going to happen later, but the egg does not know if it's going into Mary or it's going into Mike and decide who it's going to affect, right? It does what it does because the person inside is not functioning right, and a lot of times it's the nervous system that's leading into those problems.
What's ironic about this is you're treating the low back pain and the digestive issues around the low back. I guess they're affected by those nerves, but you're treating the upper cervical, up around the neck area.
Yeah, and it's an interesting story, and I know we've told it here so many times, but it's worth repeating in case somebody's watching that hasn't heard it. But at the top of the neck, there is a bone that is called the atlas bone, and when it's out of alignment, it will start affecting with your nervous system. So there's a video here that shows how nerve impulses are generated in the brain, and they are sent straight down the spinal cord, and we're getting down to the lower back area here, then out those nerve roots, and then out to the digestive system and every other part of the body. And then in turn, your body's sending information back up to your brain, and it's this cascade of information that's being traded between the brain and the body that keep everything working better above the cellular level. So at the top of the neck, when that bone is out of place, it'll start interfering with posture, because some of the nerves at the top of the neck control posture. So there's another poster here that shows two guys. One has an upper cervical area that is in the right place and aligned properly. That would be the guy on the right. The nerves are controlling the back muscles properly, pulling you into a nice upright posture. The left guy has an upper cervical area that is not right. The atlas is misaligned, and it's then interfering with the nerves that control the back muscles. And you can see one side tighter than the other, ultimately giving a short leg on the right side. And then you have to adapt to that. So when the low back hurts, it's doing its job. It's doing what it has to adapt to that short leg, and then it starts affecting the nerve roots at the low back, and then digestive, reproductive issues, bladder issues. Yeah.
Why isn't it more well known that digestive problems could be related to low back pain and then ultimately the atlas?
I think it's more just a societal thing where we don't talk about it as much. When somebody's low back hurts, you can see that it hurts because they're grabbing their low back, they're saying ouch, they're complaining to their family, their friends about the pain. But when somebody's having digestive problems, we're not really witnessing the end result of those problems to ask them, hey, what just happened there? And they don't come out of the room talking about it. So it's just not talked about. And the way we know to treat it is by then what we see on television. So for acid reflux, it's take this. For diarrhea, take this. And it's just not a dialogue.
I also think it's important to reiterate, it's a painless procedure too.
Yeah, it doesn't hurt. We've said that a lot as well. It's a very gentle adjustment to the top of the neck. It's not a thrusting maneuver. There's not a pop that's going to take place.
No, I would say watch her face. When you go to touch her, right? And just watch and see if she looks like she's wincing in pain. She doesn't react at all.
No, some of my
Well,
patients will comment they feel like they could fall asleep on the table. It's just that relaxing.
If you want to see Dr. Drummond in the flesh, you're going to be at Papillion Days
Yes.
this week, right? What are you going to be doing
Yeah,
there?
it's a great, if you've not been to Papillion Days, head down there. They've got a park that's full of a lot of vendors and people doing different things, but I'm going to have a tent out and I'm going to have my posture analyzer, and anybody that comes by that wants me to look at their posture, they'll stand on it and I'll show them what I find and explain everything and see if they've got some of those indicators like that poster was showing with the
So you'll be there
shoulders and hips
Thursday
together.
through Sunday?
Yes, Thursday in the evening, Friday in the evening. I get done at the office at 6, and then I'll head over there, and then all day Saturday and Sunday till it's over. Yeah.
You know, you've done a few of these events before where you meet patients and talk to them about NUCA care. What's the eye opener when they meet with you and they realize you're not just the guy on TV, but you're talking about this treatment, and then that light bulb sort of goes off for them. What does it?
I don't know what the connect. When I start talking about their hips and their shoulders, I don't know, that kind of grabs them. When I don't know that I understand the question fully that you're saying.
Well, I'll tell you what, the light bulb goes off when you talk to your patients, because you've brought patients on this show many, many times,
Well,
and we've heard from them what you've been able to do.
Well, for me, the light bulb was when people said, I tried medications, I was on the verge of surgery, I'd been suffering for years, but I felt like there was no reason not to try this.
Well, I guess when I talk to them and they see that I'm not treating a symptom.
Yes.
When I talk to them and I show them the underlying condition of their body, and I walk them through the step and I show them and I just explain it, then they're like, well, that makes so much sense. Why didn't somebody tell me that before?
Right. Unfortunately, people get to you after they've tried many other options. So we're here to cut that off right there, to let people know about what you do.
And there's a special offer. Maybe you'll see Dr. Drummond at Papillion Days. If you can't get down this weekend, you want to go into his office, he makes this available. The value is unbelievable. So, and because of that, it's only available for the first 15 people who call in. But you'll get a consultation, exam, and x-rays, that entire package, for only $50. The number is 402-452-3400. And he's here, his family's here, his office is here, and you'll find him in the Millard area. And then online at spinalbalancehc.com.
And a Papillion this weekend.
Yeah.
And the
Thanks for your
Papillion
time today,
Days.
But I think it's important that you're local, you're not a national guy.
And now
that comes in and talks.
this summer, my daughter is working behind the desk with me, so we've turned into a family affair
family
over there.
business.
That's great. That's awesome. Dr.
Thanks a lot,
Drummond, have a nice
Thanks,
weekend.
Colin.
Thank you very
Thank
much.
you.
Sticking with the health issues, there's a lot of